What if I told you that the way we think about depression is completely wrong? That for decades, we've been fighting this battle with outdated weapons, missing crucial pieces of the puzzle that could change everything. Hey everyone, welcome back to the channel. Today, we're diving deep into one of the most misunderstood conditions of our time, depression. And trust me, by the end of this video, you'll see why everything you thought you knew about depression might need a complete overhaul. But here's the thing. This isn't just another surface-level explanation. We're going to explore cutting-edge science, the breakthrough treatments, and the revolutionary approaches that are literally rewriting the textbooks. So grab a coffee, get comfortable, because we're about to embark on a journey that could change how you understand the human mind forever. Let's start with a question that might surprise you. Did you know that depression isn't just feeling sad? In fact, the core symptom that separates depression from other mood disorders isn't sadness at all. It's something called anhedonia. This is the complete loss of interest or pleasure in activities you once enjoyed. Imagine waking up one day and finding that your favorite song sounds like noise, your favorite food tastes like cardboard, and spending time with loved ones feels like a chore. But here's where it gets really interesting. Depression shows up differently depending on who you are. Children and teens often display irritability rather than sadness, while elderly people might present with more physical symptoms that doctors often miss. And across different cultures, the expression varies so dramatically that what looks like depression in Western societies might be completely unrecognizable elsewhere. Think about this. In many non-Western cultures, people express psychological distress through physical symptoms: fatigue, body aches, digestive issues. They're not making it up. Their brains are literally processing emotional pain as physical pain. This is why so many cases go undiagnosed when we only look for the textbook symptoms. Now let's talk about what's actually happening inside the brain of someone with depression. For years, we focused on the chemical imbalance theory: low serotonin, dopamine, norepinephrine. But recent research reveals the picture is far more complex and fascinating. Your brain has these incredible regions: the hippocampus for memory, the prefrontal cortex for decision-making, the amygdala for emotions. In depression, these areas literally shrink. We're talking about actual volume reduction, damaged neural connections, and impaired communication between brain regions. It's like having a city where the roads are broken and the power grid is failing. But here's the revolutionary part. We've discovered that depression isn't just about neurotransmitters. It's about neuroplasticity, your brain's ability to form new connections and heal itself. And there's this protein called BDNF, brain-derived neurotrophic factor, that acts like fertilizer for your neurons. In depression, BDNF levels plummet, and your brain literally loses its ability to repair and grow. And then there's the glutamate system, the brain's main excitatory network. While traditional antidepressants target serotonin and take weeks to work, new treatments targeting glutamate can work in hours. This is why ketamine and esketamine are causing such a revolution in psychiatry right now. Here's something that will blow your mind. Depression might actually be an inflammatory disease. I'm not kidding. About 27% of people with depression have elevated inflammatory markers, things like C-reactive protein, interleukin-6, and TNF-alpha. Their immune systems are essentially attacking their own brains. Think about how you feel when you have the flu: tired, unmotivated, unable to concentrate, loss of appetite. Sound familiar? That's your immune system releasing inflammatory cytokines, and it's creating depression-like symptoms. Now imagine that inflammatory response never turns off. This is why some people with depression respond to anti-inflammatory treatments like celecoxib or omega-3 fatty acids. We're literally treating depression as an inflammatory condition, and it's working. This completely changes how we think about the relationship between physical and mental health. But wait, there's more. Your genes play a huge role, but not in the way you might think. Depression isn't caused by one depression gene. It's influenced by hundreds of genetic variants, each contributing a tiny effect. We call this polygenic risk, and it's like having a genetic predisposition that needs the right environmental triggers to activate. And here's where it gets really interesting: gene-environment interactions. Some people have genetic variants that make them incredibly sensitive to stress, while others are naturally resilient. It's not just about having bad genes. It's about how your genes interact with your life experiences. Childhood trauma, for instance, can literally change how your genes are expressed through epigenetic modifications. These changes can be passed down to your children and even grandchildren. We're talking about trauma that echoes through generations at the molecular level. Now let's zoom out and look at the bigger picture. Depression doesn't exist in a vacuum. It's deeply connected to social and cultural factors. Poverty, social isolation, discrimination, and cultural stigma all play massive roles in who develops depression and how it's experienced. In our digital age, social isolation has become an epidemic. But here's the paradox: technology can both cause and cure loneliness. Social media might increase depression risk in some people, while digital mental health tools are providing life-saving support to others who can't access traditional therapy. And the stigma? It's not just uncomfortable, it's literally killing people. When individuals are too ashamed to seek help, when cultures view mental illness as weakness or moral failure, when healthcare systems underfund mental health services, we create a perfect storm for untreated depression. But here's where the story gets hopeful. We're living through a revolution in depression treatment that's unlike anything we've seen before. First, there's precision medicine. Instead of the old trial and error approach, we can now use genetic testing to predict which medications will work best for individual patients. Imagine knowing before you even start treatment which antidepressant is most likely to help you with the fewest side effects. Then there's the psychedelic renaissance. Psilocybin, MDMA, and ketamine are showing unprecedented results in treatment-resistant depression. These aren't recreational drugs we're talking about. They're carefully administered medical treatments that can produce lasting changes in brain connectivity and emotional processing. Neurostimulation techniques like TMS, transcranial magnetic stimulation, are literally rewiring depressed brains using magnetic fields. No surgery, no drugs, just precisely targeted magnetic pulses that can restore normal brain function. And psychotherapy? It's evolving too. We now have digital CBT programs that are as effective as face-to-face therapy, mindfulness-based interventions that prevent relapse, and integrated approaches that combine medication, therapy, and lifestyle changes for maximum impact. Speaking of lifestyle, here's something that might surprise you. Exercise can be as effective as antidepressant medication for mild to moderate depression. We're not talking about gentle walks. High-intensity exercise produces changes in brain chemistry that rival pharmaceutical interventions. And diet? The Mediterranean diet has been shown in randomized controlled trials to reduce depression symptoms. The ketogenic diet is showing promise for treatment-resistant cases. We're literally seeing food as medicine for mental health. Sleep, social connection, purpose, stress management. These aren't just nice-to-have extras. They're fundamental components of mental health that can make or break recovery. But here's the ultimate question. What if we could prevent depression before it starts? Early intervention research shows that catching depression in its early stages, or even in the prodromal phase before full symptoms develop, can dramatically alter its course. School-based programs teaching emotional regulation and resilience skills are reducing depression rates in adolescence. Workplace interventions focusing on stress reduction and social support are preventing burnout and depression in adults. We're moving from treatment to prevention, and the results are remarkable. Population-level screening using simple tools like the PHQ-9 questionnaire can identify at-risk individuals before they develop full-blown depression. When combined with accessible treatment options, this approach could transform public health. So, remember that question I asked at the beginning about how our understanding of depression might be completely wrong? Well, it turns out we weren't completely wrong. We were just seeing a tiny piece of an enormous puzzle. Depression isn't just a chemical imbalance. It's not just genetic. It's not just environmental. It's not just psychological. It's all of these things and more, a complex interaction between biology, psychology, social factors, and culture that manifests differently in every individual. But here's what gives me hope. For the first time in history, we're starting to see the whole picture. We're developing treatments that target multiple systems simultaneously. We're moving from one-size-fits-all to personalized medicine. We're treating the person, not just the symptoms. The future of depression treatment isn't about finding one magic bullet. It's about understanding that depression is as individual as the people who experience it, and tailoring our approaches accordingly. Whether that's through precision pharmacology, psychedelic therapy, digital interventions, lifestyle medicine, or approaches we haven't even discovered yet. And maybe most importantly, we're finally recognizing that depression isn't a character flaw or personal weakness. It's a medical condition that deserves the same research, resources, and respect as any other serious illness. So if you or someone you know is struggling with depression, remember this. Help is available. Treatments are more effective than ever, and the future holds even more promise. You're not alone in this fight, and recovery is possible. What do you think about these new approaches to understanding and treating depression? Have you or someone you know experienced any of these newer treatments? Let me know in the comments below. Your experiences could help someone else who's struggling. If this video helped you understand depression in a new way, please give it a thumbs up and consider subscribing for more deep dives into the fascinating world of mental health and neuroscience. And remember, if you're dealing with depression, please reach out to a mental health professional. The treatments we discussed today are real and available. Thanks for watching, and I'll see you in the next video where we'll explore the next topic. Until then, take care of yourselves and each other.